Go.
Good morning, sir. I'm Albert Dakbo 1. Today I'm gonna be your nurse, and of course, today I'm going to administer topical medication to you, sir. Do you have any question regarding this procedure, sir?
Nothing, sir.
Alright. Then, of course, we are going now to gather all the equipment, and of course, we're going to check the medications order against the physician's order according to agency policy, and of course we're going to clarify any inconsistencies, and of course we are going to review the patient charts for any allergies, and of course we are going to know the action, special nursing consideration, the purpose of medication, and of course the adverse effect of medication to be administered to the patient. And of course, we are going to check for the appropriateness of medication to be administered, of course, to our patient. Then, of course, we are going now to perform hand hygiene. We're going to perform hand hygiene. And of course, we are going to put on gloves if necessary. Then, of course, then of course, we're going to move the medication cards outside the patient's room, and of course we are going to prepare for administering the medication to medication area. Then of course we are going to insert passcode, or we're going to scan the employee card if necessary. Then of course we are going to prepare medication one patient at a time. Then of course we are going to read the medication administration record of our patient. And of course, we are going to take out the proper medication for our patient. And of course, we are going to read the level of the medication. Alright. We're going to read the level of medication administration record. Alright. Then of course, we're going to check for the expiration date. So, alright, the expiration date of this medication is December 24, 2024. So, alright, it is okay to be used for our patient. And of course, we are going to perform calculation if necessary. Or, we're going to scan the barcode of the package if not sure or if necessary. Alright. And of course, when all medication have been prepared for our patient, we are going to replace any container to the patient medication drawer or unit stocks. Then of course, we are going to lock the medication card of our patient before leaving it. So, of course, we are going now to transport medication immediately to the patient. And of course, we are going to keep inside the medication for the patient all times. Alright, then of course we're going to check for the time. We're going to ensure that the patient received the medication at the correct time. So it's exactly at 8:20 a.m. in the morning. So alright, it is time for the medication of our patient. Then of course, we are going to identify the patient. We are going to check for the name, and of course, we're going to check the number on the patient identification number. And of course, sir, can you please state your name and of course your birthday?
I'm Aldrin Passing, 14 years old, born on December 4, 2007.
Alright, so if our patient, he is Aldrin Passing, so alright, he identify himself. So alright, if our patient cannot identify himself, we are going to check for the or we are going to verify the patient identification on the staff members who knows the patient for second source. Alright, then of course we are going now to then of course we're going to complete all the necessary assessment before we're going to administer the medication to the patient. We're going to check for the allergy bracelet of our patient. We're going to check for the allergy bracelet. Alright. Sir, do you have any allergies on medication?
Nothing, sir.
Alright, you don't have allergies on medication. Alright, sir. Then of course, we're going to, alright. So, sir, the purpose why I'm going to administer topical on you, sir, is of course for healing and of course to avoid such infections, sir. So, do you have any question regarding the purpose of why I'm going to administer topical for you, sir?
Nothing, of course, sir.
So, alright. Then, of course, alright. Then, of course, we are going to scan again. We're going to ensure that we have a correct or the right patient. We're going to scan the barcode on the identification card of our patient if necessary. Then, of course, we are going to perform hand hygiene. We're going to perform hand hygiene, and of course, we are going to put on gloves if necessary. Alright? Then, of course, we are going now to locate the area. We're going to remove the blanket so that the area where we're going to put the topical is, of course, exposed. Alright? Sir, wait, kaya mo bang itaas ang paa mo, sir?
Yes, of course.
Sir. So, itaas po natin, sir. Alright, then of course, we are going to clean the area. We're going to clean the area. Alright, we're going to use the kidney basin. Alright, then of course, we're going to clean it with, of course, soap and of course, water. Then of course, we are going to clean it with the cotton balls, one stroke, alright, one stroke. Then of course, we are going to discard, alright. Then of course, additional cotton balls until the area is of course clean. Alright, there you go. The area now is clean, alright. Then of course, we're going to remove now the kidney basin. Then of course, we are going now to get the topical medication to its package. We're going to get now the medication. Then of course, alright. Then of course, we're going now to apply, alright. Then of course, we're going to discard it to appropriate receptacle. So there you go, we're done already giving the medication. Alright. Then of course, we are going now to place our patient on its appropriate, on its comfortable position. Alright. We're going to put, alright. So are you now comfortable with your position, sir?
Yes, sir.
Alright, sir. Then of course, we are going now to, we've done already giving the topical medication. Then of course, we are going now to remove our gloves if necessary. Then of course, we are going to perform hand hygiene, alright? Then of course, we are going now to evaluate the patient's response to medication within appropriate time frame. So what do you feel right now, sir, after I'm giving the topical medication?
It feels fine.
Alright, you feel good, and of course you feel fine, sir. So thank you, sir. I think I administered the medication correctly, and of course, well done. So alright, then of course we are going now to document the procedure to patient choice. Alright.